Hello friends, this video is a continuation of the important questions from the unit 2 OBG. So these are the 2 marks questions which is repeatedly asked from the previous year question papers. So let us see one by one. The first question is define menarche. So menarche is usually defined as the onset of menstruation, which is a normal physiologic process that usually occurs monthly, and it typically starts at around the age of 12, and the menarche happens during a time of physical or sexual maturation in adolescent period, which is usually known as a puberty. The next question is define fertilization. Fertilization is defined as a process of combining the male gamete or sperm with the female gamete or the ovum, and the product of fertilization is called as a zygote. The next question is what is ovulation? So ovulation is a phase in the menstrual cycle when an ovary releases an egg called as ovum, and once this egg leaves the ovary, it travels down to the fallopian tube where it waits to be fertilized by the sperm. So this is a definition of ovulation. Next, they've asked us the list the layers of uterus. Usually the uterus has 3 tissue layers, which is as follows. The first one is endometrium. It's an inner lining and usually consists of the functional, that is superficial, and the basal endometrium. And the next layer is a myometrium, which is a muscle layer and is composed of smooth muscles. And the next one is the serosa or the perimetrium, which is a thin outer layer composed of the epithelial cells. The next question is list 4 temporary structures in fetal circulation. So they've asked the temporary structures in fetal circulation. So these are the temporary structures. The first one is the ductus venosus. There's a vein to vein connection. So this vessel usually carries an oxygenated blood that from the placenta, the umbilical vein, to the inferior vena cava. Next one is the foramen ovale. It's an opening between the 2 atria, and the ductus arteriosus. This is a connection between the 2 arteries. This usually carries a deoxygenated blood from the pulmonary artery to the descending arch of aorta. The next one is the umbilical vein, which carries the oxygenated blood from the placenta to the undersurface of the liver, and it also supplies the liver. Next is what is vertex. So vertex means it's a crown of the head. This means the crown of the fetus head is presenting towards the cervix. Next is define molding. Define molding. So usually molding is an abnormal head shape that results from the pressure on the baby's head during the childbirth. So the next question they've asked us, the list the sutures of the fetal skull. So you can see in this diagram the sutures of the fetal skull. The sutures are the frontal suture, the frontal suture in between the frontal bone, and the coronal sutures. Okay, this is a lambdoidal suture, and this one is the sagittal suture, this one. Okay, so whenever they're asking you to list the sutures of the fetal skull, you can just write the diagram and name the sutures that is present in the fetal skull. Next is what is a zygote. So zygote is a fertilized egg cell that results from the union of a female gamete, that's an ovum, with a male gamete, that's a sperm. So that is called as a zygote. Next question is define implantation. So implantation is defined as a process by which the embryo attaches to the endometrial surface of the uterus and invades the epithelium and then the maternal circulation to form the placenta. So this is a implantation, means the embryo attaches to the endometrial surface. The next question is what is decidia? So that decidia is known as the maternal uterine tissues, which plays an essential roles in protecting the embryo from being attacked by the maternal immune cells, which also provides a nutritional support for the developing embryo prior to the placenta formation. So usually helps in the survival of the fetus by helping in the nutritional support before the development of the placenta. So the next question is, list the benefits of the amniotic fluid. So these are the benefits of the amniotic fluid. It helps in the developing baby to move in the womb and also helps in the proper bone growth. It also helps for the lungs to develop properly, and it prevents the pressure on the umbilical cord and keeps the temperature constant around the baby, protecting from heat loss. And it also protects the baby from outside injury by cushioning sudden blows or movements. So these are the benefits of the amniotic fluid. So I've just given the important questions, 2 mark questions from this unit. So in the next video, we'll see the remaining important questions from the other units. So this completes the second unit important questions. Thank you. And if you do like this video, please do like, share and comment and subscribe. Thank you.